Okay, so first things first, the different types of ICUs and what patients are going to be in each ICU. So we're gonna say that you're at like one of the largest medical centers in the country. We'll say you have more than 1,000 beds. There would be like 4 to 6 different ICUs in a large academic medical center like that. Let's get into it. First, you would have your medical ICU, your MICU. That is going to take respiratory failure patients like COVID-19 or your old school ARDS, pneumonia, your GI bleed patients, your multiple substance use patients, withdrawal patients, and any sort of metabolic derangement. So a lot of endocrine disorders and a lot of DKA. Then next you will have your neuro ICU. Your neuro ICU might be non-surgical neuro, or it might be non-trauma neuro, but often the two are combined together. So you'll have like a neurosurgical trauma ICU, because often you have people in motor vehicle accidents and they end up with a head trauma. So in this ICU, you'll have people who have had either an ischemic or a hemorrhagic stroke. You'll have your MVAs, you will have also oncology patients often. So this is where you're going to be seeing patients who have an EVD, you're watching the pressure and your cerebrospinal fluid, you have your ICP monitors, and these patients are really sick and it's a lot of really fast assessment. They're all very sick. Okay, and then next you'll have your cardiac ICU. So your CVICU at very large medical centers is split up into 2. So you'll have your CCU side and you will have your CVICU side. CCU is medical cardiac. That is the patient who goes to cath lab and they come back out and they're very sick and they need inotropes for heart support. It's also a patient who is pre-op for a heart transplant and they're sitting on a balloon pump waiting to go to surgery. It's also acute heart failure patients who need milrinone or dobutamine. It is for long-term management of heart failure. These patients can be on ECMO with CVVH, but they're not a candidate for a transplant. Essentially, CCU is any cardiac patient that they did not open up the sternum to go to surgery. So that's the medical cardiac side. On the surgical cardiac side, you have your fresh open heart patients, your patients who had a CABG, who had valves replaced, your aortic dissections, heart transplants. All of the cardiac surgery side are the patients who have had their sternum opened up and then wired back shut. Some places it's the same unit and some places it's split into 2. You will also have your burn ICU at many of these centers if it's an ABA verified burn center. Burn sometimes is lumped together with trauma as well. So you may have a burn ICU that also is lumped with trauma. Trauma sometimes is its own ICU, sometimes it's lumped with neuro, sometimes it's lumped with surgical, and sometimes it's lumped with burn. It's just going to depend on the academic medical center. So you may have a burn ICU. These patients are house fire victims. They have often some substances that are involved. You may also be taking care of, depending on regionally and where in the country, you'll have frostbite patients, and this is where you will see the severe reactions that you learned about in nursing school, your SJS, your TENS, that's the Stevens-Johnson syndrome. So these patients are very sick and they require a lot of very specialized wound care, burn care as well. And then you have your surgical ICU. Surgical ICU is anything that is not the heart and lungs and not the brain. So you have a lot of GI surgeries, you have some ortho surgeries. This can also be lumped with cancer surgeries as well, a lot of liver transplants, and these patients are also very sick. So you kind of have your surgical and then your medical ICUs, and you have to kind of decide which one's going to be right for you. Do you want to work in a place where you're going to be very hands-on with your assessment? Then you might really enjoy neuro because they are very assessment heavy. You're doing the NIHs every couple of hours for the stroke patients. If you want to be admitting patients coming out of the operating room, a surgical ICU, either cardiac surgical or a SICU would probably be a good fit for you. You really like being super hands-on and then fixing people with your hands, burn would probably be a good fit for you. So it's also important just for you to be aware, if you have specific goals, what you're looking for, which ICUs have what. And then once you get out of your massive trauma centers, you get into your mixed ICUs. And then those are ICUs that take a little bit of everything. Okay, now that we went over all of the large ICUs at like a big academic medical center, let's get into trauma level designation. Does it matter? All this stuff online. Okay, so your trauma designation just has to do with meeting a couple of requirements, and it might not be directly tied to your unit's acuity. That being said, let's go through it. I pulled it up. So a level 1 trauma center just has to meet a bunch of requirements. It's like 30 pages. We're not going to get all the way into it, but we're going to go through a couple of the requirements for a level 1 versus a level 2 trauma center. So for a level 1, you have to have a trauma surgeon on call dedicated to the trauma center. You have to have a 24-hour ER physician in the house. You have to have a neurosurgeon within 30 minutes able to get there. And then you have to have like oromaxillofacial surgeons able to be there within 30 minutes. You have to be able to have the OR staffed and ready to go. You have to have 1,200 annual admissions to the hospital. So if we think about this, the level 1 trauma designation just means that this hospital has hit a list of requirements and it can take any patient from anywhere. So they will be very sick patients. However, you may have very sick patients at your level 2 trauma center. What's an example of this? So let's say that the trauma designation of your hospital is a level 2 trauma, but you work at the best cardiac surgery program in the country. It doesn't really matter what the trauma designation level is because the trauma designation level doesn't have anything to do with the cardiac surgery program. I think it's Cleveland Clinic that's like this, like they're not a level 1 trauma center, but they have a really good hearts program. Same if you're at a comprehensive stroke center, but it's not a level 1 trauma center. Does that really matter? Not really for your specific patient population. So there's a lot of stuff online like, oh, well, I'm not working at a level 1 trauma, so my acuity isn't that good. It's like, well, level 1 trauma is applicable if you're like a trauma or a surgical trauma ICU nurse, but if you're cardiac and if you're maybe neuro, and if you're MICU, it doesn't really apply as much. So you can still have super high acuity like a level 2 trauma center. Getting into that a little bit more as well. So I worked at University of Maryland is the regional like resource center. It's this level above a level 1 because they have like one of the largest trauma programs in the United States. Other hospitals surrounding the area that are large hospitals aren't necessarily level 1 traumas. Johns Hopkins is a level 1 trauma, but all of their traumas, for the most part, got shipped off to University of Maryland. That they still had a great oncology surgical program, and Hopkins still had a great cardiac surgery program, but most of the traumas ended up going to University of Maryland. So this is the sort of thing as you're applying to jobs as a new grad, you need to know what type of ICU you're applying to, what you want to work in, and what type of acuity the patients are going to have. I made a whole separate video about how to choose a high acuity ICU. Go check that one out next, and please subscribe. Comment what you want me to talk about next. Thanks, guys.